We begin a press briefing by Prime Minister Shinzo Abe. Today, also we would like to avoid a crowd situation again, and we have an ample space between reporters. So when you make a statement and questions, please wear off your masks. That is up to you. First, we hear from the Prime Minister Shinzo Abe, and followed by Q&A time. With that, you have a stage, Prime Minister. First of all, taking this occasion, let me say, and let me extend my heartfelt prayer for all the repose of the deceased who claimed their lives by COVID-19, and sincere condolences and sympathy for people who contracted the virus. Today, across Japan, we will revoke a state of emergency declaration. In the recent days and weeks, new infections are slipping below 50, and at a point in the future, 10,000 in hospitals get smaller than 2,000. And across the world, this is very harsh, the criteria to lift a state of emergency, and all the 47 prefectures were deemed to meet the criteria. The experts panel have given the go to us at the experts panel, and this will be approved in task force meeting. After March, in the United States and European countries, explosive infections have been observed. Across the world, still over 100,000 new infections were identified, and over 2 months, lockdowns and those obligatory measures have been taken place in some countries. Even under state of emergency, there were no punitive measures and there was no lockdown. And that's something we can't execute. However, we have our own specific measures here in Japan, and only 1.5 months sufficed to terminate these infections outbreaks. This indicates Japan's model. I appreciate all the efforts by Japanese people who endured the today's times. Thank you so much for your efforts. In a very hard environment, in a grim environment, with a great mission, sense of mission, physicians, nurses, nurse assistants, and the clinical engineers, and all the public centers of employees, and all the technicians, all the medical professionals are working on an environment fraught with dangers and risk of infections. Thank you so much. Response against infections and infectious disease has superb model around the world. Last Friday, the UN Secretary General Guterres lauded Japan's efforts in that way. Per population, infections per population and death toll per population in Japan were outstandingly low versus other group of 7 nations. The initiatives and moves that we have executed today have borne the fruits, and that drew attention from the world. And here today, we will rescind a state of emergency across the board, and we will tread forward to the next stage with the Japanese people. A strong step forward. We will begin a new day. This point and on, let's change our mind. Social economic activities were stressfully under control so far, but works and lives won't go on. Here, we need to protect the lives, safeguard the lives in a new way. so that we can get our lives back. Concerts, theaters, and those cultural events nurture our minds and heals our minds. These top stars play active role, giving us exciting moments and dreams and hopes for us. Across Japan, people will travel across Japan, and I know people are looking forward to those days.
For the infectious conditions, we should be very careful, but starting June and July, little by little, step by step, we would like to recover our daily lives once again. And for the specific roadmaps, I would like to, we have indicated the roadmap. For pro baseball team games, it is going to be starting next month, but starting with the non-audiences, non-spectacle person. But then gradually we will have the audiences and people overlooking come back, and theaters and the plays. We are going to be looking at the infection level, and then we will start from little and then extend to 1,000 scope or the 5,000 person scope, and then to open largely little by phases. By having the measure to contain the virus, we will also be ready for full opening of the economy. Because we are not infected, we're not going to be opening, but from here on, we're going to be controlling the infectious disease and to work on the economy at the same time. This is essential. At the school, the Ministry of Education is going to be having the different timing for the children to start schools. And over 100 business categories are going to be starting their operation once again to create a new normal for themselves, and we're going to be showing the way. For the business operators, I would like you to refer to the guideline and to have a full-fledged operation started by phases. And the government is going to be subsidizing you, and at the most, we're going to be providing 1.5 million yen subsidy to support the small and medium-sized organizations, and we're going to be supporting you. By following the guideline fully, we cannot make the infection risk zero. We are going to be going through the test, and we're going to be having many experiences going on, and the road to fully containing the infection, we're going to be taking long times. But then many operators at this moment are now suffering in dire state for their sales and revenue, and it is a matter of life and death for their operations, and I really understand this gravely. But even having said that, we are now seeing the hope. We're seeing the light near the exit. So to the light, we have been coming through the rocky roads, and to come over the difficulties, the demand and work job should be defended and protected definitely. And under such determination, tomorrow, the day after tomorrow, we're going to be deciding on the secondary budget. And along with the first supplementary budget, we're going to be having a total of 200 trillion yen amount of supplementary budget. This is more than 40% of our GDP. This is the largest within our history, and this is comparable to any countries. And with this, I'm going to be protecting the economy of Japan. 130 trillion yen finance is going to be worked out, and the overall economy is going to be pulling the larger companies and small and medium-sized companies. And the small and medium-sized companies that have been pulling the economy and being the driver of the economy as an only one unique orders. We're going to be supporting the financial method in order to help them out, such as subordinate loan. And by assessment, we're going to be holding on with the non-interest, and at most, we're going to be having 5 years deferment of the payment in order to be able to disburse you this subsidy as early as possible. We will do our utmost. And for the financing, the Bank of Japan is going to be created a new plan, 75 trillion yen, and this was determined. And from here on, Bank of Japan and the government is going to be working hand in hand to move the real economy, and we're going to be mobilizing all our efforts. And we're going to be making a joint statement on this. We have already made a joint statement. So by all Japan, with ultimate quantity of finance is going to be injected, and we are going to be supporting the economy.
The burden for fixed costs will be reduced. The subsidies will be the most generous, up to 15,000 yen, and that's the level we would like to elevate the ratio to. The employer and employees can get directly money. That's the new system. The rents will be backed by the Japanese government. Up to 6 million yen of the benefits will be newly established. This is up to 2 million yen of the benefits for business continuity will give the businesses with a more latitude. The venture companies and startups who just started the businesses this year will be boosted by Japanese government. Depending upon the regions and the businesses, very meticulous support will be made possible by regional revitalization grants of 2 trillion yen. In addition, post-coronavirus crisis, its new days will be supported by 3 arrows of Japanese government so that Japanese economy will be back on stage. The revitalization of economy takes center stage of Japanese government and Abenomics, Abe's policies. Now, most notably, even after lifting a state of emergency, still virus will exist undoubtedly in the spaces we live in. Once we let up and once we let down our guard, in an instance, we will see explosive infections. That's how formidable this virus is. We need to have an outright anti-infection measure, but at the same time, we need to reopen the economy in full swing. We need to see those two elements in balance. I know it's difficult, and we need to face with the risks all the time, but we all are afraid of virus in the right way, and we have changed behaviors in the right way by Japanese people. Washing hands, and almost all people wear masks wherever they go, whenever they go. And the cashier have queues so that the people can avoid 3 Cs. This is a new mode of life and way of life. We need to continue, and we need to get going so that we can ward off the worst case scenario, I believe. 3 Cs sometimes come together, and that's the area we identify cluster infections in night towns and restaurants and bars, nightclubs with entertainment services and live houses. And these are the areas and facilities, and we got cooperation. Thank you so much. While gaining cooperation from experts, around the middle of next month, we will formulate guidelines, and up to 2 million of the benefits will be utilized to put in place very effective anti-infection measures. And this is one of the supports we would like to offer by Japanese government. So please make sure to safeguard yourself. But still, the speed and pace of infections will surge again. Unfortunately, depending upon the situation, there is a possibility to declare a second state of emergency. But socio-economic activities will be under control by asking people to hold back going out, and this is something we would like to avoid. The community infections risks needs to drop so that we can avoid the situation. So for us to do that, we need to identify infection people by enhancing cluster measures, which is needed. What holds the keys for that is that contact tracing applications. By function of the smartphones, people who tested positive, and if you are close to them for a certain period of time, in other words, you are very likely to be a close contact, we will trace them so that we will identify those people in the early stage. And the simulations was announced by Oxford University in the United Kingdom, so that 60% of the population will utilize those applications so that we can find out those new infections. And that way, we can fend off lockdowns, and that will yield the results according to that research. However, we do not get any privacy information. The applications we can and people can use, and the safety and security will be introduced. I encourage many people to utilize those applications.
At the same time, if the doctors think that the testing should be needed, then we should be able to provide that. In order to do that, we're going to be preparing for the medical systems. And now the antigen testing screening started, and the testing screening that is done by the private sector, upon that, we are going to be leveraging on the institutions where the university researchers are utilizing. And when we are collecting samples, we're going to be strengthening how we collect samples. And with the cooperation of the National Medical Association, nationwide we have PCR centers, 100 of them, and we are going to be expanding the number of such centers. And we're going to be increasing the budget and joining hands with the local government. We're also going to be strengthening the medical systems there too. In various parts of the nation, we're going to be supporting the designated hospitals and medical institutions that can handle COVID-19 and to secure the bed dedicated for COVID-19 patients. With the battle with the COVID at the front line, the medical professionals are making great efforts, and the medical staffs and the caretakers are putting all their efforts. And to that, we are going to be paying reward 200,000 yen at maximum. With the high-spec masks and for the PPEs, we are going to be utilizing we're going to be understanding the condition of the PPEs and the inventory held at medical institutions in 8,000 area. So by this opportunity, we're going to be having much more speed to be much more prepared. So looking into the international society, the infection is still spreading. Under this context, today, at the task force, the border control was mentioned. We have decided on having more intense border control. When people are coming in, there's going to be 100 or more people coming from 100 or more countries, and the economy stopping, and the travel and traffic of people are going to be stopped. If that is going to happen, it's going to be undermining the economy. By the lockdown in the EUs, that's also undermining the economy, and that has undermined the economy. And so with the strong revival of Japanese economy will also not happen, even if the infection in Japan is subsiding. and under control. Unless the infection is under control in all parts of the world, the true under control is not going to happen. Therefore, we should not be closed within the nation. The idea just held within the Japan is not going to be making or giving any answers to the root cause and the root problem. However, in those countries where the infection is still spreading, there is no leeway to think about that. Many of the countries that have undergone or undergoing the infections, the reality is that they cannot think anymore about the economy. They just have got to focus on the infection. However, we cannot be just focusing on the sickness for freedom and rule of law, democracy. All these values should be held. And with the countries that have the same value, we have to join hands. And we have to be working on free and open way to lead way to giving the countermeasures to control the COVID-19. The therapeutical medicine and vaccine in a transparent way under the world framework, we should work on it so that the developing nations can also work on this. And for this, next month, we would like to propose it to the G7 summit meeting that is scheduled for the PPEs. In the several months, we have been increasing up the manufacturing production. So we're not going to be relying on a country or some countries, but we're going to be creating a very strong supply chain, which is crucial for our challenges. In Japan, utilizing our experience in the past, working on infectious disease, this is the new order, new international order living under the coronavirus age, and we must be creating a strong country. This is going to be the responsibility of Japan within the international society. Even after the lift of the state of emergency is going to happen, we need to have the understanding and the cooperation of the citizens. And that is all from my side. Thank you. From here on, we're going to be accepting questions. And question is going to be answered by Prime Minister and Dr. Omi.
質問の内容によりましては、
Depending upon questions, Dr. Omi might answer to your question. Whoever wants to ask questions, please raise your hand instead of speaking out loud. I'll give a go. Then please approach to the closest mic and please state your name and affiliation. First of all, leading media outlet. This is Sato from Hokkaido newspaper. Question to Prime Minister. Hokkaido and Kanagawa were not below a criteria for lifting emergency without waiting for 31st of May. Just 4 days passed from the last day you made decision to lift a state of emergency. And what's your take? And how for longer do we need to go on the lifestyles? Now, for a long period of time, the people needed to withstand this emergency. How would you see that situation and environment? And you've shelved the revised bill of the Public Prosecutor's Office, and Mr. Kurokawa bowed out, and some people requested the Minister Mori and so forth to bow out. How do you see that? Yes, let me answer. For prefectures and Hokkaido, on the 21st of May, new infections came to decline and stretched medical readiness started to improve back then. That's why if that trend stays the course, we will be able to cease the state of emergency. That's what I said. And exactly, that's exactly that's what's happened. And we have a 0.5 head to the population of the 100,000. This is the hardest criteria set in Tokyo and other areas, but we made the cut. And Kanagawa is still over that criteria, but still less than 1 head. And the proportion of the link still has settled. So we conferred the decision to experts, a panel, and they said that we should lift a state of emergency. That's what they mentioned. Now, 3 checkpoints that we need to go past: an infection trend and how stretched the medical capacity has been, and surveillance regime, and we have considered them on balance. However, as I said, even after a state of emergency is lifted, that doesn't necessarily mean the new infections will come to zero, and there's still the virus that exists in the space we live in, and there will be prolonged battle with the COVID-19. And 80% cut will curtail the social economic activities to date, but by juggling the elevating society economic levels at the same time, we need to contain outbreak to create a new mode of life and new days. And how longer do we need to continue these days? It really depends on how we can fight off COVID-19, but at the same time, we are waiting and our hopes are pinned on the medication and vaccine. Only in Japan we see the end of infection. That's not enough. But on a globalized world, we need to see the whole virus will die away around the world. In that sense, medication and vaccines are imperative, I suppose. And to recap and also to verify how it should have been and how it was, I mean, that's the key. Nevertheless, 1.5 months has passed, and looking at infections, we started to lapse. That's the situations we are observing, but we can't relieve fully, and we are not still standing at the stage we can look back and verify. The next occasions we think the virus will subside completely, we will do it. Towards the next stage, we do all we can. And what's more, you pointed out Mr. Kurokawa, who bowed out. Over his case, Ministry of Justice and Public Prosecutor's Office draft for HR decisions were approved by the cabinet. Of course, the onus is on me, and I take it seriously, and we need to fulfill my responsibility. And when it comes to Minister Mori, Public Prosecutor's Office and Ministry of Justice need to be motivated to regain trust from the public, and we expect her to do everything she can. And the role I need to play here is to overcome this difficulty wreaked by the COVID-19 to reinstate the Japanese economy. Up until the point, our lives and economy need to be protected at all costs. That's my responsibility.
So let me entertain from another questions from another company, please. Kashima with Fuji TV. The economic countermeasure with the government, many of the criticism, there is a voice saying that the payout is slow. The subsidy, although applied, many people are not receiving their money and they are going bankrupt. And the approval rate is declining, and I think this is one of the factors that your approval rate is going down. So how are you going to be countering on this for the payment speed? And under the state of emergency, as you have mentioned, you have been restricting people's contact, people-to-people's contact, at least by 70% to 80%. And this has been contributing to the control of the infection spread. And from here on, in order not to have an explosive spread of the infection, from here on, you have mentioned that you would like the Japanese people and the citizens to stay at home as much as possible. But then maybe for contact for person to person, are you having a guideline that people can understand more easily? And you have talked about the immigration for the border control. How are you going to be relaxing the border control from here on? You have gave me 3 questions. Let me start from the number 1 question. So I think people are within the difficulties financially, and small and medium-sized companies and large-sized companies, they are gritting their teeth to stand firm. And of course, speed is very essential in order to keep their businesses afloat. And you have mentioned that disbursement is not reaching them yet. For the first supplementary budget, after its passing, 3 weeks have passed, and during this time, as you have mentioned rightly, the 2 million yen at maximum, this is the benefit to maintain businesses. And the other day, the 21st, I had an interview on that issue. And at that time, at that point, it has been 10 days past through the application started, and 400,000 business owners have been applying to them. We have been sending them 500 billion yen. And now it's 2 weeks after we have opened to the application. Therefore, we have been delivering our payment disbursed to 450,000 of them, paying them 600 billion yen in total. And the official municipalities working for the disbursement are doing their utmost. But again, with the local government, we would like to work hand in hand for speedy disbursement. And for the local banks and the commercial banks, at least for 5 years, they are going to be having a loan at maximum deferment of 5 years, and then a loan totaling for 1 trillion yen is already employed. So again, with the other loans in total, right now we have more than 700 million yen loans already on the usage. So I think people are gaining the speed in order to make the loans too. However, many of the operators are in dire state. Therefore, we're going to be responding them, understanding that people's natures are and currently, in nearly 80% of the local government, already the payment has started for 130,000 area for 100,000 yen cash handout. We would like to deliver them as early as possible, along with the secondary supplementary budget. Taking all measures, we would like to support people financially. And regarding the contact for people to people, maybe I might have answered this already, but we're going to be creating a new normal. And within this, the contact of people to people decreased the contact by 80%. But we're not going to be staying on that idea anymore. So we have to think about how to control the infection. And amidst that, what can we do economically? That is the perspective that I would like to consider. And for more than 100 business categories, we have been creating a guideline. So 100 and more business lineups, we have created a guideline. And amidst this, within the new normal, the resumption of the businesses in various businesses are now formalized. And so I would like people to refer and to create a new normal. That is my thought. So as I mentioned on the onset, the event and the sporting events and traveling and tourism, we're going to be starting phase by phase. And for that roadmap, I will also would like to show the way. And for the immigration and border control, in the external country, other than Japan, there are many other countries who are suffering the infection spread still. Therefore, we're going to be on the vigilance. But then in the future, in and out of the country, we are to understand the condition of the infection, and then we are to review again to open up for the people's travel. So it has to be juggled with the opening of the country and to prevent the infections happening. Therefore, based on procedures and thinking, we are going to be working on this and will make a judgment at an appropriate timing. Of course, the first priority is the health and the lives of the Japanese people, the citizens, and that is the first and foremost priority. From here on, we are going to be receiving questions from other managing companies. So once again, if you are going to be having questions, please raise your hand and I will appoint you. If appointed, please go over to the microphone nearby and then please name yourself and affiliation. I think there is going to be a lot of questions, therefore I will limit your question to one. Please raise your hand if you have any questions.
はい、じゃあ、大井田さん。
大井田さん。This is Oita from Mainichi newspaper. In your speech, you said Abe's cabinet central policy is the revitalization of economy up to the end of the month. But you pulled up the schedules much earlier for a week. Now, this gloomy economy and stagnant economy and subdued economy, how do you see that? And what are the key indicators of economy you bear in mind? Well, first of all, 21st as well, but today, regional infections and medical capacity, surveillance regimes, and these are the three checkpoints we need to go past, and we have made decisions on balance. However, the economy and lives of Japanese people in this country and all the companies on the brink of the recession, on the brink of financial distress, that's in a corner of my mind all the time. So alongside lifting a state of emergency, first and second supplementary budget will be approved. Employment and jobs and lives need to be protected, but at our cost. And we would like to protect it, and we would like to undergird them. And it's not that we have factored them into the criteria for lifting a state of emergency. But we do have three checkpoints that we need to go past, and we decided to cease a state of emergency. However, the largest responsibility of politics is to safeguard jobs. Since the Abe's cabinet was born, we wanted to create an environment in Japan and a country where anybody who wants to work can work. So job availability is one of the key indicators we have paid attention to. But today, we would like to make sure that people can find employers and continue to work. And that's the area we would like to go to great and all the lengths.
ご希望の方、挙手お願いします。
Mr. Koto? Goto from TBS TV. So the question refers to Prime Minister. So you're going to be completely lifting the state of emergency. So this is a milestone today. And Prime Minister mentioned today that so you have been focusing on the outlook from hereafter. But for me, I would like to ask you about what has happened so far. In April, the government has been setting the policy to allocate 2 cloth masks to every household. But then, even after 2 months, many of the households are not receiving the masks yet. So how do you, what is your recognition about this, please, Prime Minister? About the masks, the cloth masks. The 120 million masks was produced and has been packed and has been delivered. And many of the people who were working along the supply chain, people put in an effort, and I am putting sincere gratitude to these people. Right now, we have been strengthening the inspection on site. Therefore, the delivery is now on the delay more than we have expected, and that's a fact. So people may be waiting for the mask yet to be received. Therefore, we would like to do our utmost in delivering those masks. Let's say that I have just mentioned the 2 million yen maximum for the benefit to maintain business. We have paid out this benefit money to 450,000 small and medium-sized companies, and many of the local municipality officials have been working hard day and night in order to pay out this benefit. And in total, this has been already 600 million yen payment. And although these masks are not delivered yet, we would like to support these people as much as possible. Those operators who are in difficulties to make a payment even for tomorrow, we hear those voices too directly. Therefore, for the benefit to maintain business, for these benefits not approaching them yet, I feel very sorry about this. I would like to do my utmost to deliver this as soon as possible. And now we're going to be having the new stage towards new normal for everyday life, and that should be established and instilled in people's livelihood. And I'm asking people to wear facial masks every day. But then if the citizens are going to be utilizing disposable masks every day, then the demand will be 3 billion yen per 3 billion masks per month. Therefore, we're going to be increasing the production of the mask, but then we're going to be importing masks too. Right now, for this month, we have been ensuring 800 million masks, but then priority for the delivery is going to the medical professionals. Therefore, in order to answer to the demand, continuously we are having difficulties to secure the supply. And so if the cloth masks are going to be washed, it is going to be usable for several times. That's going to be suppressing the demand, which could spike largely. So it is going to be contributing to the demand and supply. The Unicharm, President Takahara is now producing the masks. And it says that if the people are going to be utilizing disposable mask along with a cloth mask, then the company and the whole Japan would be able to handle the demand for the masks too. So in that sense, I would like to deliver the masks as early as possible. Next person, please.
じゃあ七尾さん。
Anao-san. This is Nanao from Nico Nico. Dr. Omi and Dr. Wakita and the Prime Minister Abe, all the medical professionals, thank you so much for your efforts. My question is on physical distancing, and 3 Cs were encouraged, and very packed trains are a very grim situation. How would you like to counter the problem? This is a new challenge, and this is a symbolic element and anecdote of this post-coronavirus crisis. How do you see that? I mean, staggered working hours and teleworking will be enough to counter those issues? Yes, this time the outbreak has occurred and everybody needs to avoid 3 Cs. And I know many of you might have wondered if it's okay to go on the packed trains. And we have gained cooperation. And the main trains in the peak line, in the peak time, the packed trains have reduced by 70%. And because of solely down to the people's cooperation for staggered working hours and teleworking. Thank you so much. We need to continue to suppress and rein in infections. And we need to have an outright anti-infections measures, but at the same time, we need to pick up the socio-economic activities back again to create a new daily lives. In so doing, the infectious risks in train need to be dropped, and which is very, very important. Teleworking and staggered working hours are the systems that we need to enjoy cooperation, and train operators ventilate airs and ask the people to not to have a conversation out loud, and that's the guideline has been formulated to date. So Japanese people and operators are the ones that we need to gain cooperation, and teleworking is one of the new mode of lives. After post-coronavirus days, under its days, this will be one of the major pillars of our way of life. And overcrowded trains need to be more improved, and that's something we can do to improve the situation. Next question, Shimaoka-san.
Shimokubo.
Excuse me, Mr. Shimokubo. Shitakubo from Chugoku newspaper. I would like to refer the question to Prime Minister. This is about the evacuation center. So now the rainy season is approaching, and my concern is at the shelter, maybe people could be infected. So you are always saying that the people should be acting early to evacuate. But then if there should be a disaster happening, how are people going to be avoiding being infected? And how are you going to be avoiding these evacuation centers to become a cluster? From here on, this is going to be the typhoon season full swing, or else maybe torrential rain may come. So now it's a rainy season coming to Japan. And for the citizens, within the condition that COVID-19 has not been fully controlled, there could be some disaster happening. And if people should be in an area or within a position where they are in danger, I would refer them to go to the evacuation center. But then, along with going to the evacuation, I would like to request people to avoid 3 C's. And we have to do many countermeasures in order to do that. So upon the current countermeasures that we already have, we're going to be leveraging hotels and other accommodations. And as much as possible, we're going to be opening up and ensuring the evacuation center. And for facial masks and partition, we're going to be having this reserved, which is going to be included with the preparations for the local government. So we're going to be sending requests to that. And as a government, when a disaster happens, to stop infections, starting from securing the masks and partitions, we're going to be supporting people quickly in a push-type manner. And that is going to be our focal point. So once again, let me say, amidst this, when a disaster happens, first of all, I request people to evacuate first. Amidst this current situation, when a disaster happens, in preparation, Minister Takeda is working for the disaster issues.
はい、じゃあ江川さん。
江川さん。My name is Egawa Shoko, freelancer. Thank you. My question concerns why we are so late. Various measures were launched, and I know in this press conferences I heard you would do many good things, but that has taken so much time. And you touched a little bit on masks, and the 100,000 cash outs have not been come, and even application and the job adjusting subsidies and the situations around the system is improving, I heard, but still takes time. However, you can appeal the so many good things, but still that takes time. I know that entails some of the issues, probably inspection issues for masks, and probably processes and protocols. I know. there are some issues will lie. But probably, I think there could have been the fundamental issues, and you mentioned the bottleneck in inspection system. And probably there was some common thing that we can identify. And I thought we were IT advanced nation, but maybe we're IT advancing nation, and we are not fully ready for systems and machine systems. Now, confronting these situations, what's your takeaway? And you said, we are not in a situation where you can look back and verify how it should have been and how it was. But we need to brace for the second and third waves. And here today, we need to look back and what it was missing and what's been needed. I think that's what's needed. And Dr. Ami, I appreciate if you can answer to that question as well. Thank you. So first, let me answer to your question. You talked about benefits that has taken some time and 100,000 cash outs to people. At the stage, I decided the systems to Ministry of Internal Affairs and Communication, local governments, pre-advanced the preparations, and usually they couldn't do anything before the Diet approved it. But as you flagged up, these ITs and IT systems were not really prepared here in Japan, fully fledged manner. That's something we need to admit. But IT identification card and bank account were linked for some people, and that makes everything fast. And that's what it should be, and that's one of the lessons I need to learn. But still, the local governments are doing everything that they can. Also, you touched on the jobs adjusting subsidies and also verification of the processes which should have improved, and some complaints that this has taken some time and what's ongoing and what's going on the grounds. And all the time we have communication and exchange opinions, but at the same time, people actually raising their sleeves and doing the works are facing so much workload, and I really appreciate their efforts at the same time. But in the conventional screening, which has taken some time, which is true. So we need to change our mindset. We need to think out of the box, which will be of importance. We all need to change our mindset from the top to bottom in the governments, and we need to look back on how it should have been. And that's something I need to address here. For instance, benefits for business continuity, we try to gather its space for its protocol and its procedures over the last 2 weeks. Over 450,000 SMEs were received, over 600 billion Japanese yen, which is pretty fast. But still, in this grim situation wreaked by COVID-19, this is still late and lag behind, and this is something I need to admit. So we need to focus more on what we have to do going forward. To add, PCR testing issues. There are various issues and problems that we have started to identify. And over 100 PCR centers will be established so that we can ramp up the capability. And you talk about verification. The verification at full swing, and once the virus subsides, we will do it, I said. But first of all, we need to brace for second and third waves. In order to do that, medical capacity and the surveillance regimes are the importance, but medical readiness and its systems here in Japan have started to some room to accept more patients. But looking ahead, ECMO not only necessary units for ECMO, but also staffs handling those machines need to be readily available. And that's the information we also need to be aware at our fingertips across Japan. And there were some also issues, yes, that we necessarily can't get the information across all the 47 local governments, but that's the process we are going through alongside PCR testing. However, all the verification across the board over the COVID-19 will be conducted after virus subsides. Dr. Omi? First of all, you mentioned verification. I am one of the experts for infectious disease. As Prime Minister said, once the virus lapses, we need to go through complete verification of how it should have been. And all the 47 prefectures is now without a state of emergency. And other than evaluation, but interim assessment should be conducted, I suppose. But that from the perspective of experts, what's good about infection measures and what to improve in the anti-infections measures need to be reviewed in this at the stage because of the sole focus of the people in Japan. And all the anti-infection measures, as well as how the experts should have behaved and what was good about our behaviors in front of Japanese people. And that's also one of the things we need to look back on ourselves. And this is something we should publish. And does it suffice your question? You are not going to do interim verification? Well, interim verification is not one of the agenda we are doing right now, but we are going to do it once everything ends. But it's not that we have a blank slate, but while doing verification little by little and PCR testing as well, and we need to make a progress, as well as the benefits, we need to identify where the issues lie and while making progress, but including all the political decisions. Once the virus lapses, we would like to verify how it should have been.
が問いに進みます。
Now let us go to the next question. Mr. Nishigaki, please.
すいません、時事通信
Nishigaki from GG. It is about reopening the schools, and guardians, custodians, and the teachers are having great interest whether the school is opening from September or onwards. And I asked this question before too, and I think your review has been progress. So right now, how do you feel about the school opening days? And when is it that this guideline or your policy is going to be disclosed? And you mentioned about the summit meeting, G7, and about the immigration, there's going to be restriction or else maybe travel restrictions. So what is your take on this, please? Thank you for two questions. First of all, let me touch upon the reopening of the schools. School has been closed for longer times, and the education for the children should be guaranteed, which is a very big challenge for us. Amidst this condition, the government will be working to have preparation so that IT devices will be served for each family, one family per one, and create a manual for driving these forces to take all-out measures so to guarantee the education of the children. And closing of the school is now prolonged. And for the idea of opening schools in September for the new term or not, this is on the table, and I think this is one of the options that we can have in Japan. So I myself think this is a promising way to think. However, the ruling party and even in the LDP, there are various discussion going on, and people are very cautious about this resuming the school and the condition. The children and the parents, guardians, And also about the impact to the society itself, we have to be identifying what is going to happen, and we will be cautiously go on the review. We will not work so that things will be put on place quickly. That should be avoided. And regarding the G7 summit that is scheduled, the opening G7 at the U.S. itself, I understand that people are making coordination adjustment. If the adjustment is going to be well coordinated, and if the condition allows, I myself would like to participate in the G7 meeting, but then right now we are underway for the coordination with other nations too. Therefore, you have been mentioning various challenges within your question, but then based on these conditions, we are underway for coordination.
じゃあ重田さん。
Shigeta-san. This is Shigeta, Nikkei newspaper. My question is Tokyo Olympics. Today, state of emergency was lifted across the board, but still, and different countries have suffered from COVID-19 outbreaks, and Tokyo Olympics will attract many tourists and many audiences, and PCR testing capability need to be ramped up. Do you think so? And President Buck of IOC said, and the Olympic Games will be cancelled once the 2021 Olympic Games wouldn't be held. And when do you need to make a final call? At present, the IOC and Tokyo organizing committees have hammered out the discussions and prepared for the Tokyo Olympic Games to be held next year. But the battle with COVID-19 has been long-lasting and will be protracted going forward. And next year's summer, mankind will vanquish the virus completely. And as the testament for that, in a complete form, we would like to hold the Olympic Games, and that's the policies we uphold to date. So for us to realize that vision, it's not that we just okay to end the outbreaks here in Japan, but athletes who need to exercise and train itself and physical conditions, and those people will come to Japan, and we need to have a collective wisdom to develop vaccine and medication around the world. Of course, here in Japan, PCR testing and testing capability need to be beefed up, as you said, and antigen tests, as well as PCR centers of 100 to be opened, and we put in place necessary formation, which is critical. But at the same time, medication and vaccine hold the key to hold the Tokyo Olympic Games.
Mr. Peter, please.
ウォール・ストリート・ジャーナルのランダースと申します。今、アメリカと中国がウイルスなどをめぐって激しく対立しているわけですけれども。
America and Japan is now having a contention over who have been spreading the virus. So what do you think? And you have been saying that you're not going to be identifying a specific country for the spread and the cause. And at the same time, are you going to be thinking that you're not going to be depending too much on China alone? Let us say that with China and US, over the COVID-19, over the source of the emergence of the COVID-19, now the two countries are in a deep discussion, a fierce one, and Japan considers that it is a fact that the virus has spread from China. From here on, the role of Japan is, when once a pandemic happens again, likewise in the similar way as COVID-19, we have to be proposing and take lead when that happens. So in such situation, all the world must cooperate. WHO should play its role as well, too. And the diplomatic and national security for Japan, Japan's position is that U.S. is our only friendly country that is our ally. And we share the same values like freedom and democratic world and rule of law. And we are an ally country. Therefore, cooperating with the United States, we would like to work with various issues that is confronting the international society. But at the same time, China is a prominent country economically. And it is an important country too. And it is an important player within the world too. Therefore, we would like to ask China to play its role too, pro rata with their responsibility and strength. And that is what we share with the United States. So international society is requesting China, Japan, we should be playing the role that we are expected to play. And within the region, within the international society, in order to contribute responsibly to the prosperous world, we must act accordingly. And when China acts like this, we would like to highly expect that China would act so. And the other day at the General Assembly of the WHO, impartial and independent overall holistic verification should be done, is what we have been drafting out along with EU and Australia. This draft has been sent over to WHO, and China has been supporting this, and we have gained consensus. So China and US has approved about this idea, and to that, Japan was able to play a very important role at WHO. From here on, for the whole international society, the infectious disease that could impact the whole world, the freedom and transparency and speediness is essential, and we have to be sharing our knowledges and expertise, which is quite essential in the age of coronavirus. As I said on the outset, the freedom and democratism and the rule of law, these are universal values which we share with some countries, and we are going to be joining hands with these countries, along also with China, and to create a world which is peaceful. And amidst that, we would like to lead the way for infectious disease. And next, we're going to be talking about the task force. Therefore, this is going to be the last question.
Goto-san. Goto from Tokyo and Mainichi newspaper. Under a state of emergency, Mr. Kokawa resigned because he played for mahjong, for gambling. And this trust for the government has been rattled a lot. But still, the people are saying this disciplinary actions are too lenient, and the Prime Minister said you will take it seriously. Based on these angers, outpouring angers, and 60 million, as much as 60 million of the retirement benefits will be paid out to Mr. Kurokawa. Don't you think it's problematic? And also, based on National Public Service Act, a reprimand was enough. A warning was enough, but the Prime Minister's office negated, according to some reports. What are the exchanged opinions before the decision? Please lay out the situation. Well, disciplinary actions on Mr. Kurokawa back on 21st, Minister of Justice instructed the Public Prosecutor General that the warning was appropriate, and the Public Prosecutor General think and deemed that will be appropriate, and that's how they made decisions. To myself, Minister Modi debriefed the decisions based on the investigation, and the actions were taken. That's what she said. Mr. Kurokawa stepped forward to resign, and she wanted to say yes to the resignation, so the cabinet approved it. Of course, we approve the action. So, as a Prime Minister of Japan, as the head of the administrations, we approve it. To the criticism from Japan, We need to take it seriously, as we have done. At the Ministry of Justice and Public Prosecutor's Office need to do everything they need to do to regain trust alongside my efforts. Don't you think it's problematic to pay such a lot of amount of the retirement benefits? Well, they're based on the decisions that the pay has been cut. That we have an upcoming schedule, so please ask the final question.
Hoshino with Asahi Newspaper, you talked about the approval rate, and these day opinion polls show that your approval rate is going down. So what is your thinking on this? We are not going to be commenting on each and every approval rate that changes every day, but it is unchanged that we are going to do our utmost. Thank you very much. And with that, we are going to be closing the Q&A session and the statement by the Prime Minister and Dr. Omi.